Hi, my name is Aura. This is my ID, and today I'm going to be doing an HEENT assessment on my patient. Hi, my name is Aura. Can I have your name, sir?
Arthur.
Hi, Arthur. Today I'm going to be doing. Can I call you Arthur?
Yes.
Okay. Today I'm going to be doing a head, ears, nose, and throat assessment on you. Is that okay?
Yes.
Okay. Throughout my assessment, I will be touching you in different places. Okay.
Yes.
Okay, so I'm going to start off with inspecting my client's head. His head is in normal cephalic. His neck is in line with his shoulders. I don't see any deformities or anything. I'm observing his head. My client is clean shaven by choice, but I'm also looking to see if I see any masses or lumps or sores or anything, and I don't see anything. The next thing I'm going to do is I'm going to palpate my client's head. And you let me know if there's any pain or tenderness when I palpate your head, okay?
Okay.
So I'm palpating my client's head. Any tenderness or pain when I'm doing this, sir?
No.
Okay, great. So everything looks well with my client's head. So the next thing I'm going to do is I'm going to move down to his ears. And I'm looking at his ears, inspecting them. Both ears are bilaterally aligned correctly on his head. There is no drainage coming from his ears. His auricles, there is no tenderness or pain when I do this, sir?
No, there's not.
Okay, no pain or tenderness, and that's great. The next thing I'm going to do is I'm going to look inside my client's ears. So what I'm going to do is I'm going to take my otoscope and pull his ear back and up and visualize the internal part of his ear. And as I'm looking in my client's ear, I can see his tympanic membrane, which is pearly gray. I can also visualize the umbus and the conum light. And there is no cerumen in my client's ear, and that's good. And no foreign objects. I'm going to do the same thing for the other ear. Pull it up and back. And I'm visualizing inside the ear. You can visualize the tympanic membrane, which is pearly gray, and the umbus and the conum light. And there's a little bit of cerumen in this ear. Okay. The next thing I'm going to do for my client is I'm going to test his hearing. First, what I want to do is I want to take my tuning fork and I'm going to place it at the top of your head. And you let me know if you can hear the vibration on one ear, other ear, or both ears equally, okay?
Okay. It's equal.
Okay. The next thing I'm going to do is I'm going to test my client's high frequency sound through his ears. So I'm going to tap on my tuning fork. I'm going to place it at his masseter bone behind his ear. And then once he stops hearing the sound there, I'm going to bring it to the front of his ear. And I'm going to have him tell me when he stopped hearing the sound there also. Ready, sir?
Yes. Stop. Stop.
Okay, as you can see that my client can hear the sound longer than he can feel the sound in the back of his ear because air conduction is twice as long as bone conduction. So that's good. So the next thing I'm going to do is I'm going to inspect my client's eyes. And I'm just looking at his external eyes. I'm looking at his eyelids to make sure they're not drooping. I'm also looking at his eyebrows to make sure he has no hair missing or one hair eyebrow is lower than the other. I'm also looking at his eyelashes to make sure he has no eyelashes that are missing. And I'm going to look at his conjunctiva, which I'm going to pull down here. And there's no foreign bodies, no erythema there. And they're nice as pinkish red. Okay, so the next thing I'm going to do with my client is I'm going to test his, see if I can visualize his red reflex. And I'm going to use that and use my otoscope for that. So I'm going to look into my client's eyes to visualize the red reflex and his optic disc with his vessels. So I'm going to look at my nose and I'm going to come in close and look at your eyes, okay? And I can visualize the red reflex in my client's eye. Come a little bit closer. I can also visualize his optic nerve and his vessels. Great. Okay, I'm going to do the same on the other eye. So continue to look at my nose, look at me. Same here, I can visualize the optic disc and I see a red reflex. And the red is clear. However, if it was white, that would indicate that my client has cataracts. Okay, so the next thing I want to do with my client is I want to test his pupil restriction. So I'm going to shine this light into your eyes, but I want you to look straight ahead and look at me, okay?
Mm-hmm.
So I'm going to come from this way. Okay, great. Okay, great. My client's eyes constrict evenly, bilaterally, so that's very good. Next thing, sir, I want you to do is I want to do your accommodation test. So I want you to look at the tip of this here, and you can see it. I'm going to bring it closer to you. Just continue to look at it. And that's great. So as my client was looking far away at the pen here, his eyes dilated because he needs more light to focus in order to see the pen. As I brought it closer, his eyes constrict because you need less light once you bring the object closer to my client. Okay, so the next thing I want to do is I want to check my client's 6 cardinal field of gauge. So, sir, what I want you to do is I want you to look at my finger and follow my finger with your eyes without moving your head, okay?
Mm-hmm.
Okay, good. His eyes move move very well without any tics or anything, and that's good. So the next thing I want to do is I want to check my client's peripheral vision, and I'm going to do that. I'm going to have my client cover your left eye, and I'm going to cover my right eye. And I want you to tell me when you see my fingers come into your peripheral vision, okay?
Mm-hmm. See it. See it.
Okay.
I see it.
Okay, so next thing I want you to do, sir, is cover your other eye. And I'm going to cover my other eye. And I want you to do the same thing.
I see it. I see it. I see it.
Okay, good. You can put your hands down. So his peripheral vision is good. He was able to visualize my hands coming into his peripheral view. So that's good. So the next thing I'm going to do for my client, I want him to check his eyesight by reading. Sir, I want you to read this chart in a line that is most comfortable for you. And this chart is actually 20 feet away.
Okay. DHJBS.
Okay, and that is 20/20 vision. That's good. The next thing I want to do, I was going to check my client's nearsighted vision. So I want you to hold this at reading level and read the line that's most comfortable for you, sir.
Attack, they seem to yield to the weight of the Roman power. They soon buy a signal.
Okay, good. And my client's nearsighted vision is very good. He wears no corrective lens, so that's great. Thank you, sir. So the next thing I want to do is I want to check my client's nose. I'm looking at his nose. I'm looking at his the bridge of his nose and to make sure that there's no lumps, humps, or evidence that his nose may have been broken before. Sir, if I can I have you occlude one side of your nose and take a deep breath in and out through your nose? And same for the other side. Okay, great. I just checked the patency of my client's nostrils on each side to make sure he can breathe through both sides, and that's great. I'm palpating my client's nose. Sir, do you feel any pain when I'm doing this?
No.
Okay, great. And while I'm here checking his nose, I'm going to check his frontal sinuses also. Do you feel any pain here, sir?
No, I do not.
Okay. And down on his maxillary nasal passages, do you feel any here?
No.
Okay, great. So now what I want to do is I want to look in my patient's nose to check his the internal part of his nose, sir. Excuse me. So what I'm going to do is you lift your head up a little bit, sir, and I'm just going to look up my client's nose to see if I can visualize any turbulence, any polyps, anything, and I don't visualize any of that, and no excessive mucus, and it's good. And I'm looking on this side here, and I'm looking at my client's nose on the other side. I see no polyps, and no turbulence, and no excessive mucus. And his septum is not deviated either. It's midline. So that's great. So the next thing I want to do is I want to check your mouth. And as I'm looking, my client has hair around his mouth right there. And I'm looking at the hair to make sure that it's evenly distributed around his face there. And it is. And it's gray and black. And that's because it's due to my client's age. So at the same time, I'm looking at his lips to make sure they're not cracked, dry. They're normal color for his ethnicity. Sir, can I open your mouth and say "I" for me? Okay, I'm looking at my client's tongue. I don't see any thrust on my client's tongue, any open sores or any redness. It is midline and it's also a pinkish color, and that's good. Can I have you pull down your lip for me, sir? And I'm checking his gum line and looking for, abscess, sores, cracks, lumps, or any bleeding, and I don't see any. And his gums look good. Okay, great. Can you pull your top lip up for me, sir? Same thing. I'm checking for sores, lumps, cuts, scrapes, and bleeding gums, and the mucus color of his mucosa. Thank you, sir. Now, next thing I want to do, sir, I want you to open your mouth, and I want you to say "ah," because I want to look at the back of your throat. Okay. I'm looking at his tonsils. His tonsils have no exudate on them, no white blotches or no white streaks. They also are even on both sides, and his uvula goes up as he says "ah," and then comes back down, and that is midline. Looking at his mucosa for sores or lumps or any bites or anything. I don't see it on either side, and that's good. At the same time, I checked my client's teeth because I was checking for cracks, chips, or loose teeth. Okay, great, sir. The next thing I want to do with my client is I want to check his lymph nodes. So I'm going to start off with his preauricular lymph nodes, which right here in the front is air. His postauricular behind here. His jugular. His anterior cervical. His post-cervical. His submental, which is here. I can actually feel that with one finger. His occipital, which is at the base of his...
Excuse me.
His occipital, which is at the base of his skull back here. And then the last thing, unbutton the top shirt, button of your shirt. And right here, where the indentation is at, his super clavicle. And it's deep in here, so you want to make sure you get deeply deep down in here. Okay, great. Then the last thing I want to do is I want to check my client's.
Excuse me.
Want to check is my client's thyroid. Could you swallow for me, sir? And I can see that his thyroid moves freely. I'm inspecting. I don't see any lumps or any goiters, anything on his neck. I want to place my hand at the tracheal notch. Have him swallow for me, sir. And I can feel his trachea gliding up and down. And I'm palpating his thyroid. And I don't feel any lumps or anything. So what I want to do now is I want to check one side of his thyroid, left side, and then check his right side. And how I'll do that, I'm going to place my hand on his thyroid and push it to that side and palpate it. And I feel no. Swallow for me, sir. Okay, it moves freely. I'm going to do the same thing for the other side. Find his thyroid. Place it to that side. Feel it again. And I don't feel any lumps. Can you swallow for me, sir? And it moves freely. Okay. So that concludes my HET assessment. Thank you very much for allowing me to do my HET assessment on you.
Okay.